Today I'm responding to a 20-year-old male by the name of Ollie. Ollie's been out for his morning run and he's tripped over and rolled on his ankle. He's been able to weight bear off the path. On arrival, he began experiencing abdominal pain. His ABCs all appear intact without any need for an immediate intervention. He's alert and he has a GCS of 15, and all his vitals seem to be within normal ranges except he has an elevated heart rate currently. Beginning our muscular assessment, Oliver's rolled over on his ankle, so I'm going to start some questioning. So, when you rolled over an ankle, did you hear a cracking or a popping sound?
I'm not sure.
Not sure. Cracking would be indicative of more of a fracture, where a popping would be more of a torn ligament. But what I will do is use the plus disc acronym to rule out a fracture. So what I want to do first is if I can just remove your shoes, because I want to compare both feet. I removed all of his shoes so I can compare, but first I'm going to ask about the pain. So Oliver, did you feel the pain immediately?
Yes, I did.
And on a scale of 1 being not much and 10 being the worst pain you've ever felt, how much pain would you say you're in right now?
About a 6 when I'm still.
About a 6? Okay. So first I want to compare the entire leg, upper and lower. So I'm just going to feel down the leg. I'm assessing for temperature as well as crepitus, and swelling or any bruising. So I'm not seeing any signs of bruising, swelling or crepitus. And now I'm just going to assess for colour. So comparing, both legs are warm to the touch, and looking at them they both seem well perfused. Next I want to assess the joint integrity, both proximal and distal to the injury. So first I just want you to try to wiggle your toes for me on the foot that's not sore right now. Yeah. And then I'm just going to try to have you lift your knee. Yeah. To an acute angle. Yeah. So he's able to do that on that leg. And now on the sore leg, if you wiggle your toes.
It's a bit sore.
It's a bit sore. And could you raise your leg and I'll just assist you if you need it. Yeah. And you can go back down now. So that ensures that it's localized to just the ankle. So moving on to my inspection of the ankles. First I'm going to test sensation. So I'm just going to rub my finger across and check, can you feel that? And on this foot?
Yeah.
So you can feel it on both feet. Next I'm going to test for circulation. So I'm going to feel for a pedal pulse on both feet and then I'll mark it. And also assess the warmth of both feet. So they're both warm to the touch. So I'm going to inspect both ankles and compare. So inspecting the ankle that isn't injured, and now comparing it to the injured ankle. So I'm seeing obvious swelling and bruising on the distal end of the left lateral ankle, which is indicative of a hematoma or a severe ankle sprain. So now we're going to apply Ottawa's ankle rule to determine whether he needs an x-ray on his ankle. So first of all, he was able to weight bear as he walked over after the initial injury, so I'm confident that he can weight bear. Next I'm going to feel posteriorly 6 centimeters over the medial malleolus. I just want to let me know if you feel any pain.
Yeah.
Any pain?
Not more than normal, no.
No? Okay, next I'm just going to feel over the navicular bone. Just let me know if you feel any pain.
No pain.
Next I'm just going to feel over the 5th metatarsal. No pain?
No pain.
And now I'm just going to feel the posterior 6 centimeters of the lateral malleolus. And just let me know if you feel any pain.
Yeah, that's sore.
You feel slight pain?
Yeah.
Alright, so the pain that he's feeling on the posterior 6 centimeters of the lateral malleolus is indicative of a severe ankle sprain or possibly a distal fibular fracture, which we would probably assess further through an x-ray as he does meet the criteria for the Ottawa's ankle rule, so he will be transported and assessed at hospital via an x-ray. Alright Ollie, so can you point to where you're feeling the pain?
Yeah, it's right over here, mate.
And can you describe the pain to me?
It's quite sharp.
And do you know if it's radiating or is it localized?
No, I can also feel something up here in my shoulder.
You can feel it up in the shoulder?
Yeah.
So that's possibly a sign of Kerr's. So Kerr's sign would be a radiating pain to the right tip of the shoulder. So I'm just going to inspect the abdomen. So do you mind if I just lift up your shirt?
That's fine, mate.
So I'm just going to lift up your shirt and begin to have a look. So on inspection, I'm not seeing any obvious jaundice, and just looking at both flanks, I'm not seeing any bruising or any abnormalities. Oliver, can I get you to have a look at your stomach and just tell me, do you see anything abnormal about that?
No, that's normal.
So just inspecting the abdomen, I'm not seeing any umbilical bruising, so that's a negative for Cullen's sign. When you breathe in, do you feel any pain?
The pain's normal. It doesn't get any worse.
So it's probably a negative for Murphy's sign as well. What I will want to do is rule out any issue with your appendix. So all I want to do is just lift up your leg and bring it out. Will that be okay with you?
Yeah, that's fine.
So I'm just going to engage this hip flexor. Just let me know if you feel any pain when this is coming out.
Yeah. No pain, mate.
No pain?
Yeah.
Okay, great. So I'm just going to ask you a few questions. Have you vomited at all recently?
Yeah, I threw up just on my run.
So you've been recently vomiting, which is also a sign of pancreatitis. And have you been eating normally, regularly?
No, I've been eating a bit less because I just didn't feel like it.
You haven't felt like eating?
Yeah.
So that's also probably a sign of pancreatitis. And then with fluids, have you been, your fluid intake, have you kept that up, and have you been using the bathroom a lot regularly?
I've been trying. Yeah, everything seems relatively normal.
Everything seems relatively normal?
Yeah.
Okay. So I'm just going to begin my palpation of the abdomen. So that's just going to involve me pressing down on your stomach a bit. Is that alright?
Yeah, that's fine, mate.
I'm just going to begin in the area with that's farthest from the pain side. Just let me know if you feel any pain.
Yeah. There's no pain at the moment, mate.
Still no pain?
No pain. It's a bit of pain there.
Yeah.
Oh. Yeah, that's quite sore.
So it indicates to me that around the pancreas area he is feeling a lot of pain. So I want to begin my percussion now. So Ollie, I'm just going to be ending up tapping on your stomach, if that's alright with you.
Yeah, that's okay.
So again, I'm going to get at the site away from where the pain's coming. So he had all normal percussion sounds, no resonance sounds or no dull sounds, which would be indicative of like having a mass of some sort. What I will do is I'll have you roll over for me, Ollie.
Yeah.
And after 10 seconds I'll wait and I will test to see if there's any fluid in this area. Okay, that's great. You can roll over now. So I'm not hearing any dull sounds. I'm hearing all normal percussion sounds. Now I want to begin my auscultation of your bowels, if that's right. So that just involves me putting my stethoscope on you, if that's okay.
Yeah, that's fine.
I'm just listening for normal bowel sounds. So I'm hearing normal gurgling, which is good. I'm not hearing any absence of bowel sounds. So I do suspect that Ollie's suffering from some kind of pancreatitis, so we will be transporting him to hospital for further inspection. Important notes for the musculoskeletal examination of the ankle is when assessing the ankle, you want to assess the joint integrity of the entire leg, so you want to check the knee as well. Assessing the full leg is really important to ensure that the injury is just localized to the ankle and nowhere else. As well as when applying Ottawa's ankle rule, if any of the criteria are met, that patient needs to be taken to hospital immediately for an x-ray to assess the severity of the injury. Important notes for the abdominal assessment is when you're assessing the bruising, colouring, different scars and deformities of the abdomen, you want to discuss with your patient whether this is regular or normal for them. If the pain is localized, you do need to palpate all 9 regions of the abdomen, and it's important when auscultating percussion to be thorough, as you want to be searching for obvious obstructions that could be causing that pain.